Mr. Janae. Today I'm going to talk about global health. Okay, this is my thesis statement. The lack of law norms and regulations enforcement around the world create a lot of gaps in health system that affects globally and this should improve. In this presentation, I'm going to talk about how health is a global responsibility, also about the preventable and treatable injuries, diseases overwhelming. Also about how globally hundreds of millions of people are affected every year by healthcare associated infection because of the lack of enforcement. And the inadequate levels of funding demonstrate this lack of political will. Also, I'm going to talk about a solution that is given the organization, the World Health Organization, that is called Joint Action and Learning Initiative on Global Responsibility for Health, GALY. Okay, as I said before, health is a global responsibility. Every country owes all of its inhabitants a comprehensive package of essential health goods and services under its obligations to respect, protect, and fulfill the human rights. The International Human Right of Health offers a starting point for a certain and essential level. This includes health services as essential vaccines, medicines, technologies, and survival needs as nutrition, sanitation, etc. The right to health requires these services to be universally available, acceptable, accessible, and of good quality. Okay, now I'm going to talk about preventable and treatable injuries and diseases and how are overwhelming most of developing countries. The extreme level of avoidable death and diseases in developing countries is just that, avoidable. Effective intervention exists, but many people cannot access them, and the government must be accountable for its health. Women and children faces intolerable risk, including of dying in childbirth. During the course of her lifetime, a woman in sub-Saharan Africa is almost 140 times more likely to die during or shortly after pregnancy than a woman in an industrialized country, with 99% of the approximately 350,000 maternal deaths in 2008 occurring in developing countries. This statistics was given by the World Health Organization, and for each case of these deaths suffers several complications from pregnancy and childbirth. It is entirely avoidable by providing skilled birth attendant and non-inexpensive interventions. Okay, now I'm going to talk about infectious diseases that are causing millions of deaths annually. Okay, more than 4 million people die annually from AIDS, tuberculosis, and malaria. Approximately 2 million from HIV, 1.3 from tuberculosis, and 863,000 from malaria. Approximately 10 million people still need treatment but are not receiving it, and 5 people are newly infected but with HIV for every 2 people who begin treatment. And this is because the governments are not enforcing the laws. The health systems in poor countries are least prepared to detect and contain these emerging diseases. Emerging infectious diseases such as HIV, which threaten people wherever they live, pose the greatest risk to people in developing countries, and absent of global agreement on sharing the vaccines and medications needed to prevent and treat them. People in developing countries will have, as they know, have the least access to the essential medical technologies needed to control and treat these diseases. Yet, the goods and services required for global health are likely to be undersupplied all the time in these countries by individual countries, and this causes the lack of law enforcement. Okay, now I'm going to talk about how globally hundreds of millions of people are affected every year by healthcare associated infections. Okay, Abbreviations are HAA. This is an infection that is acquired by a patient during a care delivery in a hospital or other health care facility. Okay, no one should get sick seeking care. Yet globally, people are affected, many of which are completely avoidable, like the infectious diseases. No country or health system, even the most developed or sophisticated, can claim to be free of HIAs. And this is wrong because exist the regulations, but people are not enforcing them. Inappropriate use of invasive devices and antibiotics, substandard application of IPC, including injection and blood transfusion safety, and the absence of local national IPC guidelines, policies, and programs are one of the regulations that people are not following. Okay, now I'm going to go to talk about the inadequate levels of health funding demonstrate this lack of political will. This is a very important part because money is what controls everything, and people are not giving the pledge. Okay, high-income countries have not come close to fulfilling their pledge. Made in 1970, spent 0.7% of their gross national product per annum on official development assistance, finding innovative ways to ensure adequate and enduring funding with agreed upon priorities will be vital in ensuring that poor countries gain the capacity to fulfill the right to health. Okay, framing global health funding as aid is fundamental flawed because rather global cooperation requires a collective response and responsibilities, as I said before, charities and fundamental rights, where all states have mutual responsibilities. Okay, charitable giving means that financial contributions and programs are largely at the country's discretion. The level of financial assistance, therefore, is not predictable and sustainable, often failing to meet domestic needs and priorities. Also, something that affects this is the governance. Global health governance is essential because states will not accept international norms without genuine partnership, equitable burden sharing, and efficient programs that improving health outcomes. To conclude, health systems among the low-income countries are among the most poorly governed, sadly. Healthcare is either unavailable or is too expensive. Global cooperation, collaboration, and investment are necessary to ensure a safer future. It is about finding solutions. Creating new effective norms and rules for all states to follow global governance entails a diminution of state sovereignty to benefit the world's population, but it's long-term. Initiatives as GLY from World Health Organization are helping to follow these responsibilities among all the countries and globally. Thank you.